Open season is officially underway. Federal employees have until December 14th to choose a new health care plan if they want to, and there are lots of options to choose from. Walt Francis is a consultant and health insurance expert. He's author of the Checkbook Guide to Health Plans. Walt, I teased you a little bit before we went on the air. We've been doing this, you and I have talked about open season for a long, long time. And one of the things that you educated me about early on is the scope of the landscape is enormous, and people should narrow down as quickly as possible, shouldn't they, Walt?
They should. There's no reason to delay, and it's an easy thing to do, actually. It's amazing how people sit down and spend half an hour to look at their plan choices.
What's the way to try to get the scope down from 200 and some plans, I think it's 250 some that OPM's offering this year, down to maybe the 10, 15, 20 that are the right choices for somebody to consider at least?
Yeah, well, number one, there's only in any one city or metro area, maybe 30 or 40 plans, about 40 in the DC area, but that's still way too many. So what I recommend you do, well, the first thing to do is check the plan you're in to make sure something bad isn't happening next year. And you download a copy of the plan brochure from the plan website, the OPM website, or the checkbook website, and just look at the brochure, section 2. How does the plan change for 2021? And there may be some good news or some bad news, but at least check to see. Think about your health situation and look up in the brochure anything. If you plan to have a baby next year, you better look in the brochure to see how the plan treats maternity coverage, because some are free and some are not.
Is that the major thing that people don't think about, Walt, is the fact that I like my plan, I'm going to just stay in my plan? When they do change, premiums change, the coverage areas change, sometimes even deductibles change, all those kinds of things. Is that the major mistake that you think people make?
That is a major mistake. There's another one, but that's a major one. For one thing, suppose your doctor leaves the plan. It isn't in the plan network next year. There's a little bit of homework you need to do to be sure that you're not making a terrible mistake by staying in that plan. But the other mistake people make is not even looking at the possibility that there may be a better plan out there. And there almost always is. Okay, out of those 40 plans in the DC metro area, what makes you think that the one out of those 40 that you're in is the best for you? And people don't realize it's not that hard to narrow your choice down. Just any number of simple ways. You can look at plan ratings from either OPM or Checkbook. You can look at the Plan Zone website. Most of the big carriers have 3, 4, 5 plans that you can compare just from that one carrier. If you like Blue Cross, look at all the Blue Cross plans, including the one you never heard of, Blue Cross FEP. If you like GIHA, look at all the GIHA plans, including the one you never heard of, GIHA Elevate. Ditto for Kaiser, ditto for Aetna, and ditto especially for United Healthcare, which seems to offer more new plans every year than anybody can count.
And I guess the idea, if my plan's changing from year to year, all the other plans are changing from year to year. So one that you might have looked at last year or the year before that you wound up not choosing may be changing in such a way that makes it appealing this year, right, Walt?
Yes, absolutely. And it's either a substantive change or a relative premium change. Suppose there's a plan whose premium hasn't gone up for 3 or 4 years. Your plan has been going up 5% a year. Well, that introduces a big change in the relative cost of those two plans. And if you don't look to see if there's something else out there that's a lot less expensive, you're never going to find it without looking.
If I want to keep my health insurance the way that it is, I look at the plans, I look at the other plans, and I like what I've got, I'm going to keep rolling with that. I still have the option, don't I, to be able to change my dental and vision and the other options as well, right?
Oh, yeah. There's an open season that covers not just health insurance, so that's the big item, but the FedVIP plans, which are dental and vision plans. Setting up a flexible spending account is a really important thing to do for almost everybody, and only about 25% do it. If you are in Medicare and are even thinking about any of the Medicare choices you have, and there are a lot of them, the Medicare open season ends December 7th, So it's got a shorter deadline than the federal employee open season.
We have about 20 seconds left, Walt. What do you advise people to do to start? Is it checking those websites and looking at brochures?
Yeah, people have different search techniques, but going to your own plan website. But what I really want you to do is go to some other plan website. So there's an easy way to do that. Use the checkbook tool or the OPM tool, or just look at the ads you see on television. Let something spark an interest in you. I ought to check that out. Okay. Oh, I never knew about that. Again, premiums. You should not decide on a plan based on its premium cost. But by all means, look to see if there's a lot lower premium you haven't checked out yet.
Walt Francis, thanks very much. It's great to see you again, my friend.
Nice to see you.